I'm a bit late, 5 to 7 minutes, just completing my OPD. That's why. So I hope you all join in very early and we can start our live session. So before we start cases or before we start answering questions, so there were some questions left unanswered before. I'll just address one question. So there was a case of, a simple case of indigestion in my practice. The patient come for indigestion, bloating of abdomen, loss of appetite, heaviness in the abdomen after eating and all. So this was a Walaikum Salam. This was a very simple case of indigestion. I just prescribed the patient few medicines. The patient again came. He was slightly better, but not so much better. This thing continued for 1.5 to 2 months, and the patient was not improving as per what I wanted to. Then we took the whole case of the patient and we traced the indigestion after grief. If indigestion after grief, yeah, Disha, good afternoon. Yeah, so we traced that indigestion after grief, and I prescribed the patient after studying the case, adding few symptoms from the Mater Medica. I prescribed the patient a few doses of Cripidium calceolus. If you open the repertory and see that indigestion after grief, it is Ignatia Cripidium. There is one more remedy which I can get. There was a very interesting symptom in the patient of Cripidium. The patient appears older or wiser than their years. Now this is a very important line of Cripidium, because if you open the repertory precocity, then this remedy is not there. But there is a very interesting symptom in this case, in this remedy. The person appears older or wiser than years. And I prescribe the patient grief and this symptom and prescribe the patient Cripidium. The patient is much better now. The spelling of Cripidium is Cypripedium. Cripidium. Okay, and then and Cripidium is also, it has also one more symptom. The patient is over affectionate. It is basically prescribed to over excitable children. I have used this drug in my practice for cases of ADHD also. The main reason for telling this symptom, hello Dr. Babal, we just finished one case of Cripidium. So the main thing to tell you about this case, sometimes it is possible that the rubric does not contain that infrequently used medicine, but the symptom is present in the Mater Medica, and the interpretation of that symptom is precocity. Like in this case, appears older or wiser than their years. So it's always not important that you know the repertory, you know the Mater Medica, you know the organon. You must know how to interpret the patient's symptom into rubric form. And then if there are 4 or 5 remedies on the repertory chart, because every time it is not possible to have only one remedy on the repertory chart. If it comes, it is well and good. If it does not come, then through Mater Medica, through the knowledge of a Mater Medica, you have to identify the remedy, ask the patient few symptoms, and then get the prescription, right? That is what I always tell to my fellow doctors who are working with me. Okay, Navjot, yeah, you have received the medicine. You can, after a month, you can always do the TSH of your mother, and let's see how does it happen. So some questions have scrolled up. You can always write again. Suggests medicine for subchronic hematoma. See, these are very chronic conditions. Subchronic hematoma, it would require a whole case taking. Otherwise, in such cases, there are few drugs which are very specific in homeopathy. You can think about arnica, you can think about crotalis, you can think about lachesis, you can think about ruta, you can think about bellispur. But I would still suggest the case taking, the whole case is important in these type of cases, because these cases basically will teach you a lot of things if you cure this case. So take the whole case before prescribing. Dizziness के बाद anxiety and fear. Now see, whenever you get dizzy, whenever you get dizzy and whenever you are not happy in life and whenever there is a vertigo and all. So this symptom basically would be very common. I had a case of vertigo. When the patient has vertigo, he feels that he is falling down, and suddenly he feels, doctor, I hope I have not got brain tumor. This is also possible. But in your case, if you want some remedies, you can think about carcinosin, argentum nitricum, gelsemium, bedorenum, natramur, lycopodium, aconite in LM potency. So tell some symptoms of senescio or Q. When I was studying senescio in college days, I would like to tell you, we were taught that senescio basically has functional amenorrhea. Means if the lady has all symptoms which are normal, but still the lady does not have any problem in relation to menses, think about senescio. So whenever a patient, came to us for amenorrhea and he had taken a lot of other medicines, but there was no relief, we used to think about senescio. In some cases, the menses used to come, but in some cases, menses did not come. So we told the patient to go and get everything checked up and take some withdrawal bleeding medicines. But if you open Mater Medica, it is definitely written functional amenorrhea of young girls with backache. Now this backache, though it appears a very common line, but the backache symptom of senescio, I have seen it is very, very important. If the patient is suffering from amenorrhea and there is backache, the remedy you must think about is senescio. Second symptom, before menses, there is inflammation in relation to throat, in relation to chest, in relation to bladder. The patient can say that, doctor, whenever I have menses, before menses, I have pain in my throat, I have heavy difficulty in breathing, pain in the chest, and sometimes I have recurrent urine infection before menses. Now this symptom is a very, very important symptom of senescio. This is what I have seen in my practice. With that, one symptom of senescio which I have seen, that is dyspnea on ascending. The patient comes and tells you that I feel dyspneic when I climb your stairs in my clinic. The remedy, 9 out of 10 times Calcarea would get relief. But if when Calcarea fails, then you can think about senescio. One more symptom of senescio which I have seen in regarding to sleep. See, whenever you prescribe the remedy which are infrequently used, we directly don't prescribe that medicine. Whenever we fail, then we start reading and then prescribe. For example, in senescio, the symptom is great drowsiness with unpleasant dreams. Now, with this lot of drowsiness, lot of sleepiness, you normally think about Nux moscata. But somehow Nux moscata, if it does not work, then you start reading the Mater Medica, and then I found senescio has the same symptom, great drowsiness with unpleasant dreams. The patient has so many unpleasant dreams that when he wakes up in the morning, he feels, oh my God, I have not slept only. So he's drowsy. So these are 4 or 5 symptoms of senescio which I have seen in my practice. You can also think about this remedy which have these symptoms. Again, this remedy is again infrequently used in my practice, but whenever I prescribe a Polycrest and it is not working as I want, then I start reading and then this remedy come into action. I hope this is okay, Navjot. Then we can move forward. Yeah. So let us move forward. There may be some other symptoms of senescio also which I have never encountered in my practice, so I cannot tell you. These are the symptoms which I have seen in my practice. I have prescribed on these symptoms and I have got results. Okay. Yeah. So keep telling me something about 100% and thumbs up, so I know that everybody is understanding. Yeah. Thank you. So let us go forward. So I was talking about crepidium, again a very infrequently used medicine, but it worked in that case. So yeah, now you can ask. I hope Navjot that is okay, and we can move forward. In relation to menses, now there are a lot of cases, where we have symptoms of amenorrhea. Means the patient says that I feel that the menses will come. There are all symptoms of menses, but the menses are not coming. That is also again, my dear friends, an important symptom of senescio. But whenever you are reading Mater Medica, it is very important to know that if you know only one remedy, you will prescribe that remedy only. So if you have to know some remedies which are similar to senescio, having the same symptom, but a little bit different. So sensation as if menses would appear, but the menses does not come, and all the reports are normal. Think about three remedies which I have used very much in my practice. First is senescio, second is of course Mac-Car, and third again a very rarely indicated remedy, Crocus sativa and Calcarea fos. Don't miss out on pulsatilla and sepia. Whatever the menses complaints are there, in most of the cases you would find pulsatilla and sepia there in the rubric and there in the Mater Medica. So these 4 or 5 remedies, if you study with senescio, your Mater Medica would be better in comparison, because if you know only one remedy you prescribe senescio, then you keep changing the potency 200, 1M, 10M, CM, and nothing works. Okay. Yeah. So let us go forward. Ask the questions now, because I think there are no questions, or even if there are questions, it has scrolled up. Yes, anybody? So let us go something. Sir, having extreme pain in my left shoulder, mobility reduced. So what is the cause of left shoulder pain? First of all, if the patient is suffering from diabetes, then it is frozen shoulder. Then physiotherapy is very important. And then you can think about left-sided pain in the shoulders. First you think of spigelia, calmia latifolia. Then you can think about Rustock, semesifolia and coacum. Working a case on PCOD on my treatment since 2 years, with some months having regular periods. But again, since last 4 months has not got her periods. No difference in her routine, was given Calcarea. Yeah, Disha. So again, a very interesting question. And I always feel when I was, I had just started the practice and the patient used to come, I used to feel in allopathy it is so simple, only 2 hormones, progesterone, estrogen, just interchange of one hormone and the periods comes as you want with the medicines, and the period gets stopped as you want. So there we don't have to apply so much mind. But in homeopathy, everything is related to our symptoms. In this case, Dr. Disha, first of all, if it is a case of PCOD, make sure that if you have to give this is my experience, okay, you have to give an intercurrent thyroidinum. If you prescribe thyroidinum intercurrent with the so-called constitutional medicine which you have prescribed, it would give better results. If the mother is having the same problem of amenorrhea, PCOD or menses problem was there in her childhood also, or in her menstrual days, then intercurrent remedy progesterone can also be thought of. Okay. Sir, having diabetes but in control since I have frozen shoulder, what to know medicine? No. If you are having diabetes and frozen shoulder, make sure that you do physiotherapy exercise, and the medicines which I have told you, you can think about that. Progesterone, there are medicines which, or you can even give progesterone where her sister, elder sister, younger sister is suffering from the same problem. And if the mother had thyroid during pregnancy, or if the mother is taking thyroid tablet, then the intercurrent remedy is thyroidinum. I hope this is clear, Disha, because only Calcarea car would not suffice for this case, because the menses are irregular. 4 months it comes, then 3 months it doesn't. So irregular. This requires intervention of either thyroidinum or progesterone. Girl aged 21 years having increased endometrial thickness with just spotting for once a day. Now again, this is a very important symptom that the patient comes to us that Dr. menses are coming for 5 days, 6 days, 10 days. By the time this menses is over, I get the other menses. This is there. In this case, you must think about 2 remedies. First is progesterone, LM potency, single dose. Don't repeat. Or taken the history that I told you before. Sometimes in female also, with male type pattern thinking, wearing clothes, desires, aversion, you can think about intercurrent testosterone also. And In this case, there are some acute medicine that you should think about, Dr. Nojot, which I have used with very good results. So one is millifolium and second is irigeron. Sir, in pain, low potency like 30 works. If your remedy is right, I think 30 should work. आपको दिखाना है तो you can always contact on my WhatsApp number. Sir, in pain, low potency works good like 30. I have told you, 30 you can give low potency. Prostol LM, normally I start LM potency 0.1. That too, 1 globule, 10 number in 100 ml of water, give 10 strokes, take 1 spoon of water from that bottle, put in half cup of water, stir it properly and then take 1 spoon from the half cup of water. This is how I give the patient LM potency. And sometimes, I repeat also in the same way, 1 hourly, 2 hourly, depends on the case. Fissure getting sudden pain and standing better by sitting or lying after stools. Well, my dear friend Husna, whenever you are treating a case of fissure, sudden pain, sudden burning, most of the time Retania in LM potency would work beautifully. Normally, whenever I give Retania LM potency 0/5, 1 hourly, the same thing which I told you, 5 and then 6, 3 times a day for 5 days. You will get good results. So when the acute episodes has settled down, then you can think of the case, think of some syphilitic symptoms and then prescribe. I hope Dr. Husna, this is fine with you. Dr. Disha, progesterone LM potency understood. But in your case, Disha, I think thyroidinum 1M would be a better choice than progesterone. That is what I can see from your case. So first, take a detailed assessment of your case and then you can basically prescribe the medicines. So let us go forward. Now, in relation to menses complaint, it is one thing is very, very common, that sometimes there is grief. Sometimes there is grief and there is a problem in the menses. I had a very interesting case of, menses. Whenever the grief is there, for whatever reasons, she gets the menses. This was very surprising for me because in grief, normally I had cases where the menses get suppressed. This was a case where the patient told me that whenever there is grief, I get my menses. For this, she had come to me and she had told me, sir, this grief part is very common in life. Sometimes my child does not perform, my husband is not earning properly, or grief comes and normally I get my menses. So for that, she had come. Believe me, a single dose of Colocin 30, then 200 within 6 months, this was taken care of. So this was a very interesting case of, menses because of grief. So in homeopathy, both the conditions have to be taken care of with comparative mathematics. That is very important. Yeah, menses does not appear. That means because of the endometrial thickness. So in this case, you have to think about progesterone. And to stop the menses, you can think about irigeron also and millifolium also. Both. Okay. You give a dose of progesterone 30 or 200, whatever you have, or LM potency you can give at least for 3 days. Wait for 7 days and see how the patient behaves in front of you. So in that case, this works very well because of the thickness of the endometrium. Otherwise, if you open the repertory or Mathematica, there are about 40-50 medicines where endometrium is very thick. You can keep trying, but it does not work. This is how I have treated a lot of cases and they are much, much better now. Otherwise, in allopathy, what happens? They do DNC. And they say DNC have to be done because otherwise, the endometrial thickness is not going, you can keep on bleeding. But in homeopathy, it works. So you can use this concept and treat that case. So what potency thyroidinum? Normally, if I have this type of cases, Dr. Desha, I give thyroidinum 1M single dose. Okay. Treating menstrual complaint is really very interesting because, whatever the patient tells you the symptom, like because of menses problem, I have gas. Because of menses problem, I have headache. Because of menses problem, I have sore throat. Because of menses problem, I have recurrent UTI. So whenever there's a menses problem, make sure that what are the symptoms associated along with the menses the patient gets, either before or during or after, and that will guide you to the remedy very very well. This is what I have seen in my practice. If you only give, there are some who used to give for menses Vibrinopolis mother tincture, sickle core mother tincture, pulsatilla mother tincture, and gossypium mother tincture. You give and the menses comes, but again the next period the same problem. So it is not like in homeopathy we give only for menses, it is the whole case. So make sure what is there with menstrual complaint, make a chart, and then in the chart write down from head to foot what are the symptoms associated with the menstrual complaint, and you'll get the remedy. Sir, I am having PCOD, no menses, suppressed menses, so having heart palpitation, head sensation. Okay, so whatever I've understood in your case, doctor, okay, you have a problem of menses and palpitation if the menses are suppressed. Now see, if you are only taking this symptom, that because of suppressed menses you get palpitation, you are basically having only limited number of medicine where you only have palpitation before menses, palpitation at the beginning of the menses, during menses, after menses. So you can write down the remedies. I think palpitation before menses is a very very interesting and infrequent used medicines: spongia, sepia, natrum. Just when the menses is going to begin, maybe the patient gets a problem of palpitation 2 hours before, just at the beginning of menses, think of cactus and iodine, and after menses think about natrum urinol. So these are the symptoms which you basically have to look forward. For example, I'll go one step ahead and tell you, if the menses are suppressed, if the patient is suffering from amenorrhea, and then the patient has palpitation, believe me, there was a case where I tried about 4 to 5 medicine, it was not working. Ultimately, I prescribed the patient aconite in LM potency starting from 0/7, 0/8. First dose, the patient got the 7 was exhausted, then the 0/8, the patient got the menses. So this is something, aconite is only thought for acute complaints. But if you see in Matermedica, palpitation heart from suppressed menses, there is cactus, there is pulsatilla, there is lycopodium, there is Merxol, and aconite is also there. But I did not give aconite, but because we thought that aconite everything is sudden and volume. But after 4 or 5 medicine failed, aconite cured that case. I hope you are with me. Hello everyone. Yeah, so you can think about these medicines, Dr. Sir. This is for you only, Gopi Shitija. This is for you only. Okay, so this, go to that Matermedica part, and there are a lot of remedies. But I was just telling you, aconite LM potency cured that case. Okay, kindly tell some medicines for old age constipation. This question I have taken a lot many times. Okay, you can refer to my previous YouTube and you can get the remedy. I have only dandruff with hair fall age 23. See, if you are a doctor, then make sure that you first diagnose whether it is seborrheic dermatitis, it is dandruff, it is psoriasis, scalp psoriasis. There are a lot of other things also. Simple dandruff in homeopathy, if you go to see, there are 4 or 5 medicines which are very very important: natrum, mure, phosphorus, kali sulf, graphitis, sulfur. These are the medicines which you can get. There's one rare medicine if you only have dandruff, there's a remedy called as Kochkileria. So Kochkileria mother tincture, about 5 to 10 drops in oil which you apply, put in the oil and then rub on the scalp. You will find within 2 and 3 days dandruff would be better. But make sure that you before diagnose whether it is psoriasis or seborrheic dermatitis or eczema or dandruff. It would work only in case of dandruff, as you say. Okay. Sir, I need to discuss a case. When can I talk personally? Yeah, it would be difficult to talk to personally. You can write down the chat on the WhatsApp. I'll tell my fellow doctors to talk to you. Okay. You can write down the whole case, then maybe, or what is the point, then I can talk to you. Okay, Dr. Disha. So let us go forward. You understood something about Kochkileria, no? See, if you have understood the question, please tell me so that I know that you understood. Otherwise, my age is 25. I had PCOD for past 4 years. No menses, sir. Just one time in a year. Okay, because of this, facing heart problem. Yeah. So, just a minute. Yeah. So this is an interesting case. No mens for the past 4 years and just one time in a year. This is a problem. So, in this case, I think you are landing up in ovarian failure. Ovarian failure it is called as. So if this is the case, Dr. Siddhija, then you must think about the remedy Uferinum. Oopphrinum. Uferinum. This remedy will require to stimulate the ovaries, because in ovarian failure, if you stimulate the ovaries, automatically the follicles start getting manufactured. So make sure that you use the remedy or think about the remedy Uferinum. Sometimes patient gets the menses but there is no ovulation. Then you have to think about folliculinum. So you think about Uferinum. This is a very interesting remedy, and you must give that remedy in LM potency, repetition, and then the indicated remedy, and then maybe you'll get the desired result. But you have to treat it very cautiously with the homeopathy where you live in, because only getting menses once a year is a very bad sign. Menstrual symptom of X-ray. I don't think I have ever used X-ray for menstrual complaint. I have to scratch my head to think about the menstrual symptom of X-ray, because I have never used X-ray for menstrual symptom. For male genitals I have used this, but for you can always think about whenever the lady has exposure to a lot of radiation, X-ray scans, you can think about X-ray. But for me, I have never used that for females, so I cannot answer the question. Sir, kindly say post winters and heart. This is a very generalized question, Circle eat proper food, take a walk, do yoga, the circle should be good. Sir, right testis pain, USG report is normal, patient complains mild abdominal pain, burning urine, nothing else. Amit Gupta. So in this case, right testicles pain, simple right testicle pain, it can be because of trauma also. In these days, what happens is you wear tight clothing and you have not worn properly, and some hand you have fallen down or struck somewhere and you get pain, because there are no other symptoms in relation to these complaints. So in this case, you can first think about arnica, think about belly spur, think about ruta, think about what you can say, clematis, think about rhododendron, think about pulsatilla. These remedies you can think about. Uferinum. Sir, will uferinum cause? No. Uferinum will not cause palpitation. It is basically used to stimulate the ovary, because you're getting only menses once a year, and there would be no ovulation also. So that's why ovulation will stimulate the ovary, and then you can give the indicated medicines. And the patient told that he has past cricket. Yeah, so this was what I'm telling you. If there is a cricket ball history and it has taken a long time, you must think also about hememalis. So add hememalis in the remedy which I have told you. Okay. Getting frequent UTI. Now, getting frequent UTI basically in the ladies is like getting frequent cough, cold, coryza in male. This normally happens after menopause, because when there is dryness of the vaginal tract, or if the patient is suffering from hypothyroid. In these cases, I have seen people getting recurrent UTI. So in this case, again, please go home and read why the patient is suffering from recurrent UTI, whether there is some primary pathology involved, and then we can see about that. Okay. Yeah. So let us go forward. We have few minutes left. I think I can take one more question. And see, pain in the testes, you can always think about other remedies also. For example, pulsatilla is basically given when there is mumps is suppressed and you get orchitis. In your case, it is hemorrhagic remedy. Think about hememalis, arnica, belly spur, and ruta. Yeah, you can take and call the appointment. Okay. So you can do that. But I would suggest that if there is homeopath around you, one-to-one conversation, case taking is very, very important. Okay. So thank you. It is already half an hour up, and thank you for joining me. And I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Goodbye. And Happy New Year in advance.